to the Transitions Case Management Society of America Leadership Panel. I'd like to introduce you to some of our leadership panelists. And first, I'll go ahead and introduce John Heraty, who is our incoming CMSA President of Chicago. And so thank you for joining us, John.
Thank you for having me.
And then I'm going to go ahead and introduce our guest, Colleen Morley, who is our Illinois and Chicago president of CMSA, and she is our president-elect for the nation. Thank you for joining us today.
Thank you.
And then we have Melissa Popp, who is our executive director of our Hospice at Transitions. Thank you for joining us, Melissa.
Thank you.
So today we're going to talk about case management and how case management works in the Illinois level, and then how it works within our hospice. So I'm going to be moderating the session. So what is your new role, Colleen, and what will you be focused on?
Well, my new role, I will be transitioning to being past president for CMSA Chicago, and I'm handing over the reins to John, who's going to be our first social worker who's president of CMSA Chicago, so congratulations.
Congratulations, John.
In the meantime, I'm also taking over office as president-elect of the CMSA National Organization, and that's an incredible honor. I was so overwhelmed to be elected to that position.
Congratulations.
Thank you. To be able to represent case managers across the continuum of care and across the nation as well.
How long have you been involved in the organization?
Oh my goodness, it seems like a lifetime because it has. It's truly, when you love something so much as I love CMSA, you don't really count the years or the hours, you just live in the experience. So I would say I've been a member of CMSA for at least 10 years. Probably more, but I've lost track because it's part of my life.
Sure.
What inspired you, excuse me, to run for CMSA National President-elect? And how did you decide to go for this and go through with it?
I would say what inspired me to run is just this really passionate desire that I have to be the advocate for the advocates.
Mm-hmm.
Case management is one of the best kept secrets in all of healthcare still, if we've been in existence for over 30 years. But people still don't understand what a case manager does or who a case manager can be or how a case manager can help either the interdisciplinary care team, the patient, whatever's going on. And case managers live in a whole bunch of different areas. They're in the hospitals, they're in the managed care organizations, they're in the communities. They're everywhere that you've got interaction in healthcare, but nobody knows about it.
So that begs the question, and this is for both of you, what is case management and who is part of the team?
Well, I'll start by giving you the textbook definition. The textbook definition is that case management is a collaborative process that assesses, plans, implements, coordinates, monitors, and evaluates options and services that are required for our clients to help them meet their health and human service needs. That's your textbook definition.
Mm-hmm.
Anything else? From your perspective, John?
And who's part of the team?
Yes.
And I like using metaphors. Colleen gave a perfect textbook definition, but I think of very excellent adult daughters, adult sons who are managing their children, managing their parents, and they're trying to get them through a life issue. A case manager has the professional skills, whether it be a nurse or a social worker, to help a person navigate through oftentimes a very complicated health system, whether they're in the community or in a facility.
Wonderful. Now, what resources do these do you need to have available for the case management team that you work with to do their job?
Well, first and foremost, you need a patient. Second, you need the interdisciplinary team that surrounds that patient. So you're talking
Mm-hmm.
about your physicians, nurses, social workers, case managers of whatever discipline, services, durable medical equipment, hospice, home health care, skilled nursing facility. You need all the things that make it easy to transition a patient from where I work in acute care,
Mm-hmm.
you know, from the hospital back into where the patient needs to go. Whether the patient needs to go to rehab for a little while and then go back home, how are they going to be successful at home? We're not just going to discharge them from the hospital, wave them off and say, congratulations and good luck to you.
Mhm.
We're going to make sure that they have everything that they need in order to be successful at home.
So that means the community,
Yes.
you know, payer source, extra, you know, you work with them through
Absolutely.
that, you know, and that can be a big part, right?
And that's one of the reasons that the case managers are such a vital piece of the healthcare team, is because we do help navigate through this incredibly complex healthcare experience. You've got the hospital, you've got physicians and the other services, and you've got the payer, and find me somebody who's actually sat down and read their entire insurance policy.
Right.
I mean, I can tell you a story from when I was a younger nurse, where my 12-year-old son ended up in the emergency room from eating, you know, too much cheese, and ended up getting a horrible case of constipation. And we were in the emergency room overnight, and then I got a bill for over $4,000 because I hadn't read the insurance policy, realizing that it didn't cover emergency room care.
Interesting. So
Wow.
it doesn't seem like every patient who goes into the hospital may be aware that there is this case management piece or the
Exactly.
availability. Now, does every hospital system usually have this? And if they don't have it available to them, how do we, you know, help them understand that?
Every hospital system has a case management department. And
Mhm.
it's made up of case management nurses, social workers, discharge planners, administrative services, and we're there to help not only communicate with the insurance company, but we're also there to help with the discharge planning and the coordination of care and benefits after the patient leaves the hospital.
Very good. So, Colleen, I think you have some questions for our
I do.
executive director of our hospice.
Melissa, hi. So how does case management coordinate in with hospice and palliative care?
So specifically with hospice, our case managers are heavily involved in the patient's care, even on a day-to-day basis, and they're the ones going out to see the patients. And they're sort of the glue to the whole piece, you know, as you were mentioning, and you know, they're kind of the messenger to all the other members of the interdisciplinary team in overseeing the total care of hospice and
So
palliative.
they are the care coordinating entity
Yes.
there.
Yes.
That's excellent. And so when we're talking about hospice and palliative care, that's two different areas. And we know that hospice is for end-of-life care. Can you talk a little bit more about palliative care, and how can palliative care help my chronic condition management patients? From a hospital perspective, we're really concerned about readmissions, and a lot of the patients that we see coming back in have these chronic conditions like congestive heart failure and COPD, or chronic obstructive pulmonary disease. So we really need to try to manage them outside rather than having them come into the hospital so frequently.
Sure, so our palliative care team is, you know, out in the field seeing the patients, a lot of home patients, and the goal, of course, is to keep them at home and not send them into the hospital. In the event that they are in the hospital, you know, getting them out as quickly as possible and figuring out a way to ensure that they're not sent back to the hospital. So education, we can manage patients in their home with IV fluids if they need it, you know, IV Lasix, whatever it may be, based on the disease process, to prevent further hospitalizations.
And that plan of care is overseen by a palliative care physician as well, correct?
Yes, and nurse practitioner and social
Beautiful.
worker, yes.
Wonderful. So we've talked a little bit about how they help prevent the rehospitalizations, and symptom management is very, very important with our chronic condition management patients. How does the palliative care physician and nurse practitioner work on creating a plan with the patient?
So we have disease-specific, you know, treatment plans. Of course, every patient is unique, so care plan is developed based on the patient. So the nurse practitioners work heavily with the palliative care physicians and other specialists to ensure that their symptoms are best managed in the home, you know, specifically. Dr. Kapur, you mentioned those care kits that we're able to provide based
Right.
on disease-specific conditions.
We have jetpacks in our palliative care program that we try to predict what might come about, and we create the plan of care based on the patient's goals in palliative care, as Melissa mentioned. And the idea is to delineate before a acute crisis happens what they would want to happen in that situation. And oftentimes if the prognosis is poor, those acute maneuvers may not work. So we educate them along the way, practice polypharmacy, manage their symptoms, and of course address the psychosocial, psychological side of what they're going through as well.
Excellent. So when we're talking about, we talked a little bit about the resources that people need. Social determinants of health are 80% of the issues when it comes to people coming back into the hospital or having readmissions or even being able to manage themselves correctly. So 80% of what we as case managers do is connecting people with resources, with services out in the community. John wrote a great story for our books. CMSA Chicago puts out a new edition of our Tales from the Front book every year. And John wrote a phenomenal story last year about a patient that he worked with as a telephonic licensed clinical social worker, connecting this lady with services. Do you remember the story that we were talking about? Where you connected her with a plumber to fix the leak?
Oh, right, exactly.
Yeah. Can you tell a little bit more about your experience, even in doing that kind of stuff?
Right, yeah, and it's interesting because, yeah, so just doing a telephonic piece of it, she lived in a very rural part, and it just, sometimes things get complicated for people environmentally in their home, and they're trying to figure out who are trustworthy contractors, how they're gonna get the money to fix it, and just getting on the phone, talking to local people, and just trying to harness as many community action people as possible, because there's all sorts of aging offices and disability offices where they have money set aside for housing assistance. And I'll just say this finally, to me, one of the most important things of case management is to wrap the case management in a clinical blanket, because it's not just having a rote conversation. I mean, a hospice particularly, but even any type of case management is understanding that there's a human being there and talking in a certain way, yeah.
Right. Yeah. And just being sensitive, I think, to the, not only the situation the patient is going through with compassion, but also like the, what they've been through, in their life. Everybody's a unique individual, and that's one of our commandments here at Transitions actually, is that we treat them as, a unique individual with a unique plan of care, and we're not cookie cutter.
Mm-hmm. Exactly. I mean, my mantra is patient-centered care, and I feel that that's exactly what case management does, is really takes a look at, the patient, their situation, includes their family, and really wraps those services around, like John said, to make sure that all the gaps are closed for those patients.
I think one of the things that's unique about Transitions is the fact that sometimes the patient is fairly stable. They may have a 6-month or less prognosis. However, a lot of the support we're providing is strictly for the family. And, sometimes they're the ones that need the support most.
Exactly.
Very good point. And oftentimes, we'll see in these cases that addressing the psychosocial need allows them to, the family as well as the patient, to come to an area of acceptance, and so that they can get the right type of comfort-focused care at the right time. Otherwise, we're pursuing chemo when, there is another option there.
Well, and that also, going back to the readmissions discussion that we had briefly, a lot of times the patients are not the ones that are saying, take me back to the hospital. It's
right.
The families who may be getting very anxious with, mom or dad going, doing that slow downward trajectory, and they're like, quick, I'm not ready for this, But in moving with the patients and bringing their families into it and creating that safety net for them, it gives them a little bit more reassurance and a lot less anxiety to just knee-jerk throw mom in the emergency room because I just can't handle this.
Yes, absolutely.
Very good point. The voice of the family is very important. There is that saying, a psychiatrist once taught me, is that, don't treat the family through the patient. However, they do have a large portion of it, especially if they're the power of attorney for healthcare, to know what the wishes are and act on that patient's behalf. So thank you for those points. So thank you very much for the information on case management as it relates to nursing
And social work.
and social work.